Good afternoon, everyone. Thanks for joining us today. This is our 95th Facebook Live event since, 22 months ago or so. Let's start with weather. I know that you all love when I give you a weather forecast. Usually it starts up conversation having nothing to do with weather, but nevertheless, we are currently under a winter weather advisory. This is not a major weather event, not sounding any alarms. I don't know if this storm has a name, and I don't expect that you should be all that anxious. I just want you to be aware, though, if you don't already know, we are expecting mixed precipitation, including freezing rain and sleet, through the day tomorrow. The rain will transition to sleet and freezing rain likely overnight. Certainly will have some impact on morning commute, so please be safe. Want to be sure that you're prepared for ice buildup on streets, sidewalks, etc. And we expect the freezing rain to transition back to snow later in the morning tomorrow, tapering off by the end of the day. I'm going to use this analogy. Tomorrow we have a little bit of a weather situation. There will be risk. There is no need for us to take emergency action of any kind, and the county is not taking steps to restrict any activity, because I do want to get to that at the end. And again, talk a little bit about what is and is not an emergency. But tonight, we expect a little bit of ice, and just to be safe while you're out on the roads. Be patient with the public works crews. They'll be out handling sand and salt. Some of you will feel there's too much sand and salt. Some will feel there's too little. But be safe around them. Utility crews are tow companies that are out there providing assistance to those who might have particular vehicle issues, and of course our emergency dispatchers, all standing ready with our first responders. And be patient with all of them. We're grateful to all of them, and keep an eye on the weather. Currently, we are monitoring 731 active cases. Now, this of COVID-19 related cases. This puts us at about where we were on the 1st of December. New cases per 100,000 has dropped to 35.4, and the daily new cases 7-day average is 159. If we were tracking positivity rate, and I don't want to use that data point any longer because it is a bit obscure, it is a bit skewed, is now under 10%. And I would tell you what I will say several times today, knowing what we know about both this particular variant of the virus and where we are today, we are not in an emergency situation, period. I know that there are those who will want to take certain significant precautions, and there are those who will want to have all precautions eliminated. I know that there are those who listen to public and private health officials, and you have every right to. There are those who will make their own choices, as well you should. As a government official responsible for telling you when government should intervene for the purposes of managing an emergency, that is in fact my job. We are not in an emergency situation, and I believe there is no need for emergency steps for government to take. I believe that you ought to have the data, the information, you know the risk, you know the steps you can take, and you must make choices. That's what I believe. Now, we are currently in a scenario where the state of New York still has emergency mandates. I'm going to get to that in a minute, but I want you to know where I am in my mindset, and you can say that that's based on politics or lack of information. I get it, but it is our job, and it is a job that I truly cherish as county executive, to evaluate where we are as a community, both the data, the reality, and public concern and sentiment, to help you understand what we believe is risk and what we believe is appropriate moving forward. We are not in an emergency situation, and I believe firmly that we need to move now and transition from the use of emergency powers. We live in a form of government, again, whether it's you see it as sort of old-fashioned, but we live in a form of government where people like me, executives, exert certain emergency authority when there is an emergency situation. We use those powers to ask you to stay off the streets when there's snow, to take certain steps if we think there's a public health risk. At this moment in time, and I've believed this for a bit, but I'm saying it as clearly as I can today, we are not in an emergency situation. This is not a crisis moment, and therefore the use of emergency powers is not appropriate. There may be a public debate and conversation and legislative action, but there is not need at this moment in time for emergency action by an executive. And I believe that, and believe that we have to transition from that. Let's talk a little bit more about the data points. 105 individuals hospitalized. The majority of those hospitalizations are among those who are not fully vaccinated. The most severe hospitalizations are among older patients with significant comorbidities. Now, we've always said this, hospitalizations are a lagging indicator, right? So you get this glut, if you will, of positive cases. And again, it didn't have to be COVID, it could be something else. Positive viral cases, they go up, and we had that. We're up at 8,500 active cases at one point in time these last few weeks. Hospitalizations not as severe. We all know that, right? Not as severe as it was earlier in this pandemic, and so we know that hospitalizations didn't rise at the same level that positive cases did. But as cases start to decline, so too will hospitalizations. They will decline several weeks after a particular case. So that said, hospitalizations remain a lagging indicator, and of those 100 we say 105. So of the 105 hospitalizations, 37 COVID positive individuals hospitalized for reasons not related to COVID, while 68 of those are hospitalized due to complications from COVID. Let me repeat that. Today, 37 of our hospitalizations are individuals who are there for other reasons, have tested positive. They're not there because of COVID, they're there with COVID. The state has started to provide, several weeks ago, started to provide this information. We're providing it now on our dashboard. I'll get to that in a moment. 37 individuals hospitalized today are hospitalized with COVID. Hospitals have to treat them that way. They have to protect from transmission of the virus, but they are there not because of the severity of COVID, but because of some other matter, and test positive with COVID. Of our hospitalizations today, 68 individuals are there due to COVID, complications related to COVID, and we are with all of them. Our thoughts and our prayers, our hopes are absolutely with them. Believe me, we don't want anyone hospitalized. We don't want anyone to succumb to this virus, and I certainly know the human toll of it. You will now see on the Dutchess County dashboard this very information. So we have removed the complete test data point because it's no longer of any value. One, it's a compilation of the number of tests that we've conducted over the course of the 22 months. But secondly, with over-the-counter tests and access to those test kits, there just isn't any reason to identify that information any longer. You will see on the dashboard, however, the breakdown of hospitalizations. Those with COVID and those who are there for some other reason but test positive with COVID, and those who are there because of COVID. We think it's an important data point. The state and federal government are sharing that in a more aggregated basis, right, by region. We're providing it to you by county. We think it's valuable. We know it's valuable in order to identify the severity of a virus that we're dealing with, and so you'll be able to track that with us over the course of the next several weeks as that information is available there. But again, based on these data points, we are well beyond a point where one could claim we're in an emergency situation, and therefore it is my belief that the state of New York has to be very clear about why certain mandates are in place and when they will end. I do not believe that there is a need to have a standing mask mandate today. I don't. I know that there are those who disagree. I don't believe that that needs to occur in daycares, schools, or in the public. School superintendents, the teachers union, and elected leaders like myself have been calling on the state to identify what is the metric that they're using and must be achieved in order to end the mask mandate. If the answer is we'll know it when we see it, if the answer is we're not there yet, if the answer is anything other than how are we telling you we're measuring this, then it is inappropriate, period. it is inappropriate. And so we're joining others across the state. And again, Teachers Union has said this of late. School superintendents are asking this. The ones in Dutchess, believe me, they feel the pressure from families who want kids out of masks immediately. They understand the pressure from others who want to remain in that situation. And again, they get it. They are directed under the jurisdiction of the state of New York. The state of New York is not telling us when the end is. And again, it's not a matter of predisposing, not saying, well, there's some political argument here. What is the measurement one's using? I can tell you right now, there isn't one they are using. Now, they're taking in all of this data as we are. And at the end of the day, they're just making certain statements based on that data. But there isn't an endpoint, and there needs to be. There's an off-ramp here. And I believe it is now. I believed it was now for a bit already. Some of you agree. Some of you disagree. Some of you claim it's based on politics. I can assure you that we've lived through this for 22 months. I've been on the right and the wrong end of a lot of choices these last 22 months, but I can tell you very clearly we are not in an emergency situation, and emergency powers are not any longer necessary. That has to be confronted, and we're going to continue to press and ask the questions, because we are at a point now where we need to start. We need to more than start. We need to ask real solid questions. We don't want to censor information. We want balanced approach. We want access to real information so that people can make choices in their lives. What went wrong these last 22 months? What information was shared? What wasn't shared? What went right? What missteps were made? How do we make sure that we don't repeat some of the same mistakes that we made earlier on in the pandemic? Using data and science that has now produced different information, we have to take it in. Science isn't we accept things in a state of freeze. It means we take in new data, take in new information, and make new decisions based on it. What worked and didn't work? And if we don't ask those questions seriously, we do a disservice to ourselves and to future generations. We also need to own up that there's damage that was done to businesses and to families and to children and to seniors. And rather than simply ignoring it and saying these are the things we had to do, we really do need to ask, are those steps and were those steps things that we should have done, and how will we be sure to make the right choices moving forward? If we don't do that, we don't give meaning to a great deal of loss, and we're being dishonest. And so our approach has always been to be as transparent as we can, to tell you what we think, and to let you go out there and make choices. Moving forward, today we are not in an emergency situation. We are not. And I do not believe emergency powers ought to be extended. I do not. I believe that as it's my responsibility to make those kinds of assessments for us as Dutchess County residents. At the same time, we all have to have the hard and serious conversation about asking the questions and getting real, honest information about this pandemic, the decisions were made, what worked and what didn't work. And there needs to be an honest, earnest effort to do that. And I believe that we all ought to be pushing for that. And so, moving forward, we're going to continue to work to press the state to be very clear on their expectations. But again, you've heard my position. We're going to continue to press and continue to give you what information we have. That's the data points. We continue to operate vaccination and testing operations at certain locations. The JCPenney's location at the Poughkeepsie Galleria, that is with decreasing demand. We are scaling back. We are now on Thursday, 4 to 7, and Saturday, 9 to noon, vaccinations. Testing is Tuesday to Thursday, 1 to 7, and Saturday, 9 a.m. to 1 p.m. And of course, every time we're open at that location and the Dover site, over-the-counter test kits are available. Take one, go home, use them for yourself, use the information to protect yourself, and test kits available. The Dover location, this is the former CVS in Dover, that clinic is open tonight, 4:30 to 6 p.m. That's in partnership with Dr. Neil Smuller, who we're very grateful to, and that is a vaccine opportunity. Testing operations are Tuesday to Friday, 4 to 7 p.m., and that's going to run now through February 11th. Today through February 11th, testing at the Dover site, 4 to 7 p.m., Tuesday and Friday. Also, as they're open, over-the-counter test kits are available to you should you wish them. Additionally, we've distributed in partnership with schools, municipalities in the state of New York, 130,000 over-the-counter test kits. Take them, use them. We have been partnering this week again with municipalities. That's been ongoing. and that'll continue next week as well. You may not get special alerts from municipalities. They're simply making it a part of their operation. So you might see something on social media. I think in Red Hook they're partnering either with the library or the community center. Again, that's the one I remember since I lived there. But you're not going to get a major alert that says this is the opportunity. They'll advise as is necessary as they organize that distribution, and they'll be easily accessible to you. Additionally, the county continues our distribution, as I said, at the former JCPenney's and the former CVS locations in Poughkeepsie and Dover during our operations. County departments will have access to them if you're in and around doing business. DMV, Office for the Aging for some homebound residents. Again, they'll be available and around. Not a major push in that regard, but they'll be accessible to you should you need them. You can always just ask if they have some available at any of those locations. They'll provide you a test kit. Additionally, this Sunday, February 6th, we will be again at the Dutchess County Fairgrounds, 11 a.m. to 1 p.m. Sunday, February 6th. This is a drive-through distribution at the Dutchess County Fairgrounds in Rhinebeck, and that you can follow on social media for updates. Schools continue to receive test kits, and they've been distributing them. Very aggressive effort to get those out. Test-to-stay opportunities through schools we've been partnering with, and of course, if you wish, the federal government's made test kits available online. They're mailing them to you. I will say I did order as a test. I ordered mine the day they became available. I have not yet received, and then I do know some people ordered them the day they became available and have received them. So, but nevertheless, www.covidtests.gov. That's where we are. Again, the data points all in the right direction. We are at 731 active cases, 104 total hospitalized, and we did that breakdown with you. I do not believe we are in an emergency situation. We ask you to be safe. We ask you to take in the information we have, make smart choices, and as we've said all along, we hope you stay healthy and be kind to each other.